So let's talk about Entropion. First, understand I am not a vet. I'm not a vet tech. I'm an experienced giant breed owner. Have had dogs for 40 some odd years. We're not going any further than that because I'm old. But Entropion. So Entropion basically is when either the upper or the lower eyelid rolls in and starts scratching or irritating the sclera, the white part of the eye, or the cornea. And if it's left untreated, can lead to vision loss and blindness. And if you've ever had a hair stuck in your eye or an eyelash stuck in your eye, it's incredibly painful. So it's not fun, right? We diagnosed her on Monday with having mild bilateral, meaning on both sides, Entropion. And because she's young, well, let me back up a second. There are two treatment options, and one is tacking, and the other is a full resection surgery. She is so young that resection surgery is not advised until the face finishes growing and the skin is developed all the way to maturity. In giant breeds, maturity happens back and forth between 18 and 24 months, some a little earlier, some a little later, but a while from now. And eyes are always an emergency. So there wasn't a lot of choice in having it done. We elected to do something called tacking, which is where stitches are put into the eyelid down to the cheekbone and pulls the eyelid back. And if she'll hold still, you might be able to see some of this, hi baby girl, some of the stitches. And that is why she's in a cone, because stitches can get pulled out and then you have a lot of problems if it destroys tissue for the eyelid. Interestingly enough, because she is so young, there is a hope that, and in 40% of the cases it does happen, 40%-ish, right? It happens that this tacking will correct it 100%. And we won't need to have resection surgery. Resection surgery is a pretty significant surgery in that it literally opens up the lid, removes skin, removes muscle, sewn back together, and you hope that it works. So, let's try the easiest, fastest, less invasive procedure first, always, if there's time. And there was time. And so that's the procedure she had done on Tuesday. She got 5 stitches under each eye. And she really hates the cone. The cone really annoys her. But, I'd rather this than have to deal with a resection. So, some of the breeds that Entropion is more common in are flat-faced breeds, what's called bradycephalic breed. And those are, forgive me while I look at my notes, pugs and bulldogs, Frenchies, Boston Terriers, anything with like a shortened snout. Obviously, that's not her. Another group of dogs that this can be in are wrinkled or loose skin on their face, such as Shar-Pei or chows, bloodhounds, Rottweilers even. And then, of course, any of the giant breeds, the Mastiffs, the St. Bernards, the Newfoundlands, the Great Danes, Irish Wolfhounds, anything that is a large structure around the eyes has the potential for doing this. You're chewing my finger. Okay. Interestingly enough, it can also happen to cats. I have a friend who, when I was telling her about Squish's Entropion, she goes, "Oh, my cat had it had tacking done 3 times. And it was like, okay, I didn't realize, but apparently it's the same condition. That hurt, big girl. I know. Here, play with this. Anyway, the challenge we're facing now, as you can see, is navigating life as a 13, 14-week-old St. Bernard, or sorry, Newfoundland, who who has to navigate the world with this thing on her head. Hi. That annoys her. But bless her heart, she's doing her best. Anyway, I hope you found this helpful.